Next up, we have excessive knee flexion. This is a very, very common gait abnormality that really you'll see in your neuro clinics, in your outpatient clinics, in your SNF inpatient. And this one, like a lot of the other gait patterns, there's a variety of reasons as to why somebody ambulates with an excessive knee bend or knee flexion. Sometimes it could be that just due to pain. They just injured their knee. You may see this. Someone injures their knee and they're just walking around kind of with a bent knee. It could be because they actually cannot physically get that knee to go posteriorly. So they have too much tightness in that posterior capsule of their knee where it does not allow them to extend the knee, therefore it stays bent. Normally when we see this, we'll see it during the stance phase. So when they first go to step, you're going to see that knee stays bent as they come through. Knee stays bent, walk up, knee stays bent. Now, if you notice, a lot of times they can still get a flexion of the knee during their swing space. So if I'm keeping my knee bent, I can still bend my knee, but it's just during stance I'm not getting that full extension. Sometimes it's very obvious, when somebody is lacking 30, 40 degrees of knee flexion, almost about like this, it's very obvious, very obvious. They walk in, you can tell that they don't have that full extension. When it gets a little bit more difficult to depict is some of those that only have maybe 5 to 10 degrees of knee flexion. Now this, it's still important to keep in mind. It's a little bit hard to see with the black, but even if they have this and I come up, if you can see, I still have a little bit of a knee bend. Sometimes, again, that's difficult to depict, but it's still very pertinent that we do depict that. And then that's when we want to go in and get a range of motion measurement. Okay, Susie, it looks like you don't quite have full knee extension when you're walking. I do my range of motion assessment, and I do see that she's lacking 5 to 7 degrees. We need to be working on stretching that posterior capsule, work on when they walk, get them to push that knee back into a straight position. Because as you'll learn, it's not good for the mechanics of their knee if they keep walking on a bent or flexed knee.